Hey everyone, and welcome to the AgeTech Connect podcast, where we dive deep with innovators, entrepreneurs, and industry leaders to figure out how technology can make the world a better place for older adults and those that care for them. Today, I'm having a conversation with Stuart Hamilton, the CEO and founder of Amba. Stu and I will be diving into his backstory in creating Amba, how diverse, passive sensing modalities can improve operational efficiency and clinical care, and the exciting future of healthcare data and value-based care. Stu, it's great to have you here today. Thanks for coming on.
Oh, it's a pleasure. My pleasure.
How have you been?
Good. Everything going well in the United States, Canada, and the UK, where we have our operations.
There we go. Well, let's go ahead and get started. So tell me about what got you into age tech, because I know I kind of had that, classic serial entrepreneur route in tech, but what was it that made you want to get into helping older adults specifically?
Yeah, and as you mentioned, in common with many other people who are participating in this amazing sector, it started with a personal journey for me. So I'm a pretty late joiner. I've only been in the industry for like 10 years, and I work with people every day who've been doing it for 30 or 40 years.
Mhm.
But my own journey, as you mentioned, my education is engineering and computer science. I've been involved in startups ever since I finished my PhD, and some of them went well, some of them less well. I learned a lot along the way, but one of them was very successful, and I thought, great, I'm done with that period of my life. I will get involved in some businesses as an advisor and an investor and all this sort of stuff. And at the same time as that was happening, my parents, I'm delighted to say, got old. And so, as in, and by that I mean my parents reached a stage in their life where rather than supporting me and making sure I was okay, the tables were steadily turning. And
Yeah.
like for so many lucky people, I found myself looking after my parents, and that's where my journey into senior living technology began. Was how incredibly disappointed I was with the technology that was available to help me look after my mum and dad and to help other people look after my mum and dad. I was very surprised, so wanted to do something about it.
That's a lot of times where the best business ideas come from is that personal experience that makes you go, wow, something's really missing in this market. What was it when you were taking care of your aging parents? Like, what were some of the specifics that you saw that you said, I really need to address this?
Well, and I should just clarify, when I was doing that, I had absolutely no intention of establishing a new business. That was exactly
Yeah.
not what I was setting out to do. I was kind of done with that. This was initially a slightly more selfish project. I was just going, I want my mum and dad to remain independent and happy and healthy for as long as possible. Obviously, I want that for them, but I kind of want it for me as well. And not only do I want it for me, I want to feel at any point in the day or the night that they're okay. And
Mm.
so that's what I was setting out to achieve to start with. And so, am I doing the things that I need to do to keep them safe and well? Are they okay at this very moment? Can I, when I've woken up at 2 o'clock in the morning, gone, oh, I didn't speak to dad today. Do I call my brother and say, did you speak to dad today? Do you know if he's okay? He was going for a walk this afternoon, right? Do we all know that? So it was that sort of motivation. It wasn't a business idea that was driving me. And all I could find in terms of the technologies to help me do that were primarily technologies that were focusing on discovering that something bad had happened, which is all very good, and you need to know that. You need to, make sure that when somebody gets into difficulty, they're either able to summon help or help can be automatically summoned for them. But ideally, you want to reduce the potential for someone to have a fall or reduce the chances of them suffering for a serious infection, keep them out of the hospital. Those are the things you actually want to do rather than discovering something bad's happened. And so I just couldn't find anything that would help me to do that with the ease that I really needed. I wanted it to be easy for me, as in I didn't want to have to do very much unless there was a need to make an intervention. It definitely needed to be easy for my mum and my dad. I couldn't be asking them to press buttons or do anything or write anything down. And it also had to preserve respect for their privacy and dignity. So the idea of cameras in their bedrooms and bathrooms and stuff, that was a complete non-starter for me. So there was just this gap there. I just thought, how am I going to fill that gap?
I want to go into how you're kind of using these creative modalities, but you're talking about the previous solutions, and it reminded me of, kind of like the classic life alert tagline of I've fallen and I can't get up. It's like, well, why don't we stop it before the fall happens, right? Like the intervention starts at I've already fallen. We've kind of already missed the mark, right?
You got it. And there's so much, with huge respect to the providers of those sorts of technologies, that
Mm.
that's one of the profound limitations of that sort of solution. You do want to know when someone in difficulty, as we all know, right? The longer somebody is unable to get themselves up off the floor or help them off the floor, the worse the outcome is going to be for them. Even if they only found themselves stuck on the floor because, as my dad did, putting a sock on, he didn't
Yeah.
crash onto the floor. He just lost his balance and he couldn't get up. And so you do need to find that out. But solutions that rely on seniors doing something are just inherently unreliable. The vast majority, some great studies been done, clinical studies and other less clinical studies exploring the propensity of a senior to press a button when they are in difficulty. And most seniors find themselves immobilized and unable to get up, who have access to a nurse call system, don't press the button. And there are
Yeah.
fantastic reasons why they don't do that. So, yeah, we need to find ways to to reduce the chances of someone finding themselves immobilized in the first place because of a fall or an infection, whatever it might be. But we also need to find ways to discover that they need help that don't rely on them pressing a button or crawling across the floor and pulling a string or remembering to wear a pendant or a wearable thing on their all that stuff. They look great on paper, but they don't do the trick in practice.
Because you've started quite a few tech companies, and I imagine that principle is pretty consistent across age ranges, right? The more friction, the more action you demand from the customer, the consumer, the less likely they are to use the product. Like people have an amazing aversity to actually doing something to use their product. So it needs to integrate seamlessly. And then you combine that with older age, lower technological proficiency, potentially cognitive decline, or some sort of injury, and that principle becomes all the more important.
Absolutely correct. As we age, we not only find it more difficult, for example, to answer a perfectly simple question. Are you feeling better today than you were yesterday? I struggle to answer that question. Asking somebody who's dealing with changes to their cognition and memory and so on, questions like that. And when those questions are actually determining the kind of care you're going to offer to this person,
Mhm.
just asking an individual to remember how they were yesterday or how many times they've been to the bathroom recently and or are they drinking enough water? All of those are things that it's our responsibility to find out and then make the interventions that keep these people safe and well and healthy. And so essentially what we did at Amber, what I did initially and then turned into the business is look for sensors of various kinds that we can deploy in the homes of seniors, initially my parents and then my friends' parents and so on. Sensors that can automatically collect information passively about the health and well-being of individuals so that the only real involvement that the senior has to have is at the beginning to provide their consent to do that, to say, look, is it okay? We're going to collect some information about your resting heart rate, about your hydration, about how many times you leave your residence and things like that. We're going to do all that stuff automatically. We're not going to trouble anybody with that information until and unless we discover that something's not quite right and we maybe need to make an intervention. And that's essentially what we do at Amber. And the insight that we used to create the service was
Mhm.
to minimize not just what seniors have to do, but what family members have to do, what professional caregivers have to do. We just sit in the background collecting information and analyzing it, and then just raising an alert when something could use a bit of attention. Hence the name Amber, which obviously we spelt wrong because we're a startup. But rather than red alerts that say something terrible has happened, and we can discover that something terrible has happened, the alerts we want to provide are something not quite right here. This individual's resting heart rate has been elevated for the last few days. Their bathroom visits have doubled. Their sleep quality is declining. Do with that what you will, but most professional caregivers would say, well, I'm at least going to check for a UTI and then explore if there's some other infection brewing if that test is not positive. So that's what we do is collect
Yeah.
information with minimum effort from the senior or the caregiver or the family member that's involved.
So were you saying Amba, you're saying it's like amber, like the color?
That's right. Amber
Instead of
Alert
like
is a
a red alert, it's
you
a
got it.
amber alert. That's kinda interesting. I did
Yeah.
not make that connection. You guys should like use that in a tagline or something. I didn't see that on your website.
Yeah, well, we did have one in the early days that more directly referenced that, and then we went to empowering caregivers, enhancing lives, and that's my
Mm,
favorite one that we've used over the last couple of years. We're now a bit more, as we are advised by our marketing professionals, a bit more focused on promoting the outcomes that we deliver right up
mm,
front. So you just
yeah,
go Amber and you talk about reduce hospitalizations by 50%, reduce falls by 34, whatever it might be. And so we get straight to the outcome these days rather than the strap line that I do prefer, frankly. But there you go.
yeah. I guess can't get too cutesy. I think your new approach is probably better. I really want to get into how you're using these specific modalities to affect all those outcomes that you talked about. But I'm
Yeah.
interested before I move on in that early stage MacGyvering process that you had, because I'm envisioning this situation where you're a tech expert. You're a guy who knows how to solve complex problems using technology. And then you have this problem presented to you with your parents. Was there this phase where you were just kind of like searching online, picking out
Oh,
random sensors, putting it in your parents' house? Like, how did that work?
you got it. My dad was taking over 200 pills a month,
Oh
right?
my.
He was suffering from, and it's not unusual, absolutely
Yeah,
not unusual. He was, I was going to say suffering from, he wasn't suffering. He had some fantastic physicians helping him, but he had a form of cancer that didn't present any symptoms because it was caught early enough, but a whole bunch of different pills he needed to take. He had pills for his cholesterol and pills to manage other aspects of his, and he lived to be just shy of 90 years old, and he was in pretty good shape till right up to the end. He died at home. He didn't have one in the hospital. But the point was, just take that point, right? Over 200 pills. I would go over to his home. I'd moved him to just around the corner from where I was, and I would load up his pill dispenser with all the different pills to be taken at all the right times and stuff. And part of the challenge of doing that is that when you're around at your dad's place, loading a load of pills into a machine, all you got from your dad is, "How you doing, son? How are the kids? You know, whatever. Hey, did you see Liverpool at the weekend? What do you think? Do you think they're gonna?" And you go and listen, Dad. Just at this very moment, I've
yeah,
really got to get this right.
I
Okay,
gotta
if I
focus.
get this wrong, we're in trouble. So there's
Uh-huh.
that, and you get past it and you get it all loaded up and go, right, you've got my attention. What are we talking about? But how would I know if he was after I'd done all that work, if I went over there the following afternoon and the machine is still sitting there, how was I to know that he'd taken it? The first version of managing that process for me, again, if this was 10 years ago, was I literally stuck a motion sensor to the back of his pill dispenser and then
There.
set a little rule on my little platform that says he should be taking his pills at 8 o'clock and 12 o'clock and 5 o'clock and 9 o'clock. If that machine doesn't move for more than an hour after the point that he should have taken the pills, I'm absolutely certain he hasn't taken the pills. So it was that basic. Some of the things we were doing were quite basic. I was buying everything I could get my hands on that was designed for helping seniors and stuff that wasn't. And frankly, I found the greatest potential in some really interesting sensors that weren't designed specifically for use by seniors, but they happened to be absolutely perfect for what I was trying to do, which was gather information about health, activity, safety, sleep quality, whether they're taking their pills, all these different things. It turned out that the collection of sensors that we needed to do that and the collection of sensors that we still use today was not, on the whole, developed for seniors, but work absolutely brilliantly in that setting.
So you kind of repurposed a few on the market sensors to accomplish that. That story you told about the pills reminds me, my grandparents are kind of in that stage where we're, moving them into assisted living communities. And, they encountered a lot of the same issues where when we, moved my grandmother out, she had a series of old pill bottles. Like, she just had pills that she had stopped taking and just had a cabinet full of random pharmaceuticals. We're like, "You shouldn't have all these. This is dangerous." She's like, "Oh, I keep them just in case." And we're like, "Don't, don't keep them just in case." And
You got
then
it.
the other end of that is that in their new facility, they have a person managing them taking the pills. But, both my grandparents are complaining because somebody walks in and they hand them a pill cup and they say, "Take your pills." And they say, "We have to watch you take the pills." And it infantilizes them to a degree. It makes them feel, less independent, less
Yep.
competent. And it kind of reinforces their decline to an extent. But unfortunately, they don't have a better solution where they're living. I imagine you
Oh
took
boy,
a better solution.
there are some fantastic solutions, I'm delighted to say now. on the market, and we've been fortunate enough to deploy, hundreds of these systems. And so what, as we were just mentioning, we collect information about sleep and health and activity
Yeah.
and nutrition, so on. The medication part of what we do is in many ways the most sophisticated bit of both our platform, but also the most sophisticated component of the entire solution that we offer. And what it is the pharmacy is still responsible for packaging the medications on a long tape. And you might have seen them, there'll be a tape, and the
Mhm.
first little packet on the tape will be, these are all the pills that Stu needs to take at 9 o'clock on the 1st of June in the morning. And then here are all the pills he needs to take 4 hours later. What happens is a QR code is also printed on that little package. The
Mhm.
tape is rolled up, a week or a couple of weeks of pills are dropped in the back of a machine. The machine is a perfectly attractive device. Very unusually for us, it does involve the senior interacting with a piece of equipment, but the
Mhm.
device just sits on the counter. And when it's time to take the pills, it plays a little tune and lights up. It drops the little bag onto the bed of the machine. It's automatically put a little rip in the bag so that the person can take it. And it's great and amazing. The first time we deployed a set of these machines for a whole bunch of older adults, we were doing it thinking, wow, I wonder what they're going to say. Are they going to say, no, 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 I prefer having the nurse come in 4 times a day and so on and so on. And you're dead right.
Yeah.
They were going, look, I love the nurse, but 4 times a day, coming in and saying, you got to do this and you got to do that, instead of this machine sitting there, particularly when you're saying to the senior, hey, listen, if you forget, don't worry about it because we know, because our Amba platform says this resident is an hour late taking their pills, give them a
Mhm.
call. Hey, listen, your machines, can you hear it? It's ringing, it's sitting on the counter. You need to go take your pills. Or if you don't get a response, go see them. Or look at our platform and go, oh, look, they have forgotten to take their pills. It's 10:30 at night, but they're now asleep in bed. And you can see that as well on the platform. Then you say, well, you know what? Maybe I'm going to leave that, or maybe that's too important. We've got to go wake them up and they got to take them. But medication management is a very popular aspect of our system amongst residents, but also very popular with nurses who want to
Oh,
be
I bet.
nurses. They don't want to be people who walk up and down corridors. There are nurses who all they do is hand medications over to seniors and witness them taking them. And that's not why you become a nurse.
Yeah, that's
Um,
not what you go to school for and get all that education for. There's not only do the nurses not want to do that, but it's just not a wise use of their time, from an
oh,
operational standpoint and from a personal fulfillment standpoint as well.
absolutely correct. And so that's exactly what we've seen with this aspect of the system is that labor can be directed towards, making a difference to the seniors that are being cared for by whichever care organization is providing that care, for sure.
So how did y'all at Amba move from these kind of various point solutions? So you're able to find all these things that may or may not have been targeted towards older adults or just sensors that you could rewire for older adults. How did you move from this, and this to kind of like a complete integrated solution for operators and older adults?
Yeah, well, to be fair, right from day one, when I was the only user, the simplicity of the platform was key. So when we just started out and literally was a small number of seniors that we were caring for, even when it was just some sensors for collecting health information, some sensors for measuring sleep quality, some sensors for measuring comings and goings from the senior's home, some sensors for measuring use of certain appliances and so on. Even then, when you've got 4 or 5 different
Mhm.
sensor types from 4 or 5 different companies, because inevitably the best system for measuring sleep quality is just not going to be made by the same company that makes the best discrete long battery life door sensor. It's just not going to be the same company. So right from day one, it was important that we weren't using multiple applications. I used to have until recently a directory on my iPhone of all the applications that I would have to use to look after my dad if I
Yeah.
hadn't Amber. And it was just crazy. It was like 18 different apps. I was like, this isn't going to work for a couple of reasons, right? One of them is I'm not going to open 18 different apps and just check
Yeah.
things and make sure everything's okay. That's one reason. So there's the convenience reason of having a single, really simple user interface that just uses the data that we collect. But the second reason is the data points from all these different sensors, when you put them all together, you can triangulate them and produce way more interesting
Mhm.
insights and much more reliable information when you are combining 3 completely different data points and say, oh, I think we might have this problem. So there's the combination of the data is really useful, but also the ease of use is critical. And another, as you can see, I wear glasses. Another important feature right from day one was I wanted to be able to just open the app on my phone or on my desktop, but particularly on my phone, I wanted to just be able to open the app going, is everything okay at the inevitable 3 o'clock in the morning when I suddenly go, oh, I didn't speak to mum today. And without putting my glasses on, I wanted to be able to go, oh, no, everything's fine. So that if the screen is green, so if all the icons that we're using to indicate that
Very
something isn't quite
cool.
right are green, I haven't even got to put my glasses on. And similarly, when you now look at our dashboard where you've got loads and loads of seniors, on the same dashboard, it's a sea of green because most of the time everyone's fine. And that's part of the challenge in our sector. We're looking after human beings, okay? It's not okay to kind of miss a few
Yeah.
problems, right? So we're constantly checking in, depending on the care environment. If you're in a memory care unit, you've got people going in and out of people's rooms every 30 or 60 minutes just to make sure everything's okay. All of that labor is wasted on the people who are absent. You want to direct all that talent to the people who need a bit of help. And that's part of the simplicity of the platform is to go, I can see loads of green. Oh, I can see some amber icons. I can see some red icons. That's where I need to direct my caregivers. Whenever an icon changes to amber or red, an alert gets created, delivered as a notification or a text message or a robotic phone call, whatever you want, to get a caregiver to the right resident at the right time to make the right intervention. So that simplicity is absolutely key because we're talking about very, very busy people who've got way more important stuff to do than looking at an app or looking at a dashboard. They've got people to reassure that they're okay. They've got people to help change a continence pad or remind them they've missed their medication or help them to dress. Those things are so much more important than staring at our beautiful dashboard.
Yeah.
So it's got to be simple and it's got to fit into the day of the families and the caregivers to make it really easy for them to make the right intervention at the right time.
You talk about this dashboard from an operational efficiency standpoint. Are y'all in senior living homes only now, or do you still target individual older adults' homes or even hospitals? Where is Amba utilized?
So the sort of ideal situation for an Amber deployment is where you have a senior who's just begun to receive some form of organized care. So you can use Amber before that happens, and it's great. But once you've got a little bit of professional involvement, you've just gone, you know what, my mum has just come out of the hospital, and I've said to her, hey mum, it's time for us to get a little bit of help. We're going to get somebody to come in for an hour or two a day. That first part, that's the sweet spot for involving our system. As I say, it works great earlier than that, and I used it earlier than that with my own parents. But once there's a professional there, it just means that each day, they'll be arriving to visit your mum or your dad, and they'll be glancing at the app, or they'll be using our AI to say, I'm about to visit Stu. How's he been the last 24 hours? And the vast majority of the time, our application or the AI is going to say, just fine. Slept well last night, went out yesterday, stayed up a little bit later than usual, but slept in a bit, everything's, and that's the point, everything's on. But every now and again, they're going to be going to do that visit and they're going to go, I'm just going to check how everything is. The phrase that they often use is, I just want to know what I'm walking into, right?
Yeah.
And they'll look and go, oh, this particular individual, for example, just simple, this particular individual slept really badly last night. Now, we don't know why that was and so on, but at least I know going in, if Stu presents a little bit grumpy and a little bit lethargic, he may have an infection or whatever it might be, but take into account the fact he actually only got 3 hours sleep last night. And if you got 3 hours sleep, you'd be a bit lethargic and grumpy as well. So when you've got some regular, just initial professional involvement, that's a great time to be deploying our system. So we work with home care providers to do exactly that. And then all the way through that continuum from a little bit of care in the home of the senior through to a lot of care, through to even live-in care, Amber can provide really great, useful information to help keep that person as independent as possible. And then if the individual chooses to move into an independent living community or assisted living or memory care, Amber works throughout that continuum. When you get to skilled nursing and hospital care, it's still useful, But in those environments, there are a lot of people around. So the need to be making observations when there's nobody around in terms of how someone's doing stuff, it's
Mhm.
still useful in terms of automation. But it's not quite the game changer that it is
Mhm.
from the beginning of care at someone in someone's home all the way through to memory care. We can make a real difference to both the efficiency and the effectiveness of care provision and the length of time that the individual will spend in each of those settings. We've got great
Mhm.
data now showing
Yeah.
that you will spend, if you move into independent living and there's an Amba system or a similar system deployed, you will live in independent living for longer than if you move into an independent facility that doesn't have a system of this kind in place. There's great evidence from us and from other organizations that that is the case.
And you can totally imagine how that's beneficial for kind of everybody involved. I mean, especially with the older adults wanting to age in place, a big driver of people having to move to some sort of assisted living or an independent living is just that, people, it's the uncertainty, right? From the
Yeah.
kids, from the caregivers that says, like, I think mom's going to be good 99% of the time, but I'm just really not comfortable with that 1%, right? That 1% is a big risk when it means fracturing a hip or laying in bed, having an incontinent episode, having a stroke, right? You need to know that you have that 1%. And it's such a shame to move an older adult into, a higher level of care when they don't necessarily want to go just for that 1%. But it's like, oh, I'd feel so bad if that 1% turned out to be something really dangerous. And to the independent living facility, it's an angle, right? Because they want people to stay in their communities, right? If you have an independent living home, you don't want people to move out every 2 years, right? If you could keep an individual for 5 years, 8 years, that's more money, more profit for them, more comfort for the older adult. So it seems to work out for everybody.
You're absolutely right. We got some really amazing case material that shows that to be true. Unusually, only discovered this when as I say, I've only been in the industry for 10 years, but
Mhm.
discovering that these communities that have multiple acuity levels that they can support. And I was thinking, well, if we deploy our solution, people are going to not need as much care. Maybe they're not going to, maybe they're going to go, no, we don't want this system. We want people to take as much care as possible. Turns out, of course, is exactly the opposite. Keeping people independent and not requiring so many hours of care provision is great for everybody. It's obviously great for the individual, but it's great for the providers of care services to just know that they are making the right interventions at the right time for the right people, and that the people that they're not present with at this very moment are safe and well and healthy, and that you'll be alerted when that's not the case. But yeah, it is a bit of a however many wins it is. It's probably 4 wins. It's a win for the resident, a win for their families, a win for whoever's funding the care provision, and it's a win
Yeah.
for the care provider. It's really fantastic.
Now, I've been lucky enough to talk to a lot of great founders that are kind of offering solutions in this area for like monitoring older adults and talking about all the benefits of having greater insight into, how the older adult is moving, living into their health. What really stands out to me about Amba is your creative use of multiple passive sensors. You see, a lot of great solutions involving video cameras and they have, their ways of managing around those recordings, but I wanna get into specifically how you guys use the non-video sensing modalities to kind of get the same results. How do you, use those different technologies?
Yeah, first of all, so as the point I made earlier, we don't make any of these sensors. We're constantly on the lookout for better and better sensors that do more and more interesting and valuable things. And so, whilst we do have camera based systems integrated onto our platform, and we do have wearables integrated onto our platform, we don't have a single client where all of their residents use a wearable or all of their residents use a
Oh,
camera.
I see.
There are places where people are using a few wearables and a few cameras, but we find that a combination of passive sensors is the way you got the highest chance of going along to a community of people, whether they're all living in one IRC or it's 100 people living in their own homes. If you want the highest probability of going to them and saying, hey, listen, our job, our role, our mission as your care provider is to keep you safe and well and healthy and to keep you living right where you are for as long as possible. And that's what we're here to do.
Mhm.
It's going to help us if we can collect some of this information automatically and the Amba platform can monitor it automatically, if you want the highest chance of everybody going, that sounds great, let's do it, you've got a much better chance of doing that if you don't have wearables and cameras. Because there's plenty of people who'll go, maybe, but I don't care what you tell me about how encrypted that camera thing is. I just don't want to spend the final years of my life with cameras dotted around my most private rooms of my home. And similarly, as you get older, I mean, I don't wear anything on my wrist anyway, but as you get older, you're less comfortable with something on your wrist that's secured firmly enough that it can collect the information that we need, in terms of heart rate and stuff. So it's
Yeah.
not that we completely reject those technologies. It's just
Mhm.
that we don't see them widely accepted by exactly the people that we're trying to help, right? If it makes people feel uncomfortable, you've got to go back to the drawing board and say, sure, we can gather some really useful information with some cameras and some people in a call center looking at the thing and going, oh, look, somebody should go and check, great, but not plenty of people don't want to do. I wouldn't want to do that. And so back to your point, we've just looked for passive sensors for quite sophisticated things like nighttime is a great time for
Mm.
collecting health information. It's very repeatable. You've got hours and hours to do it. You kind of know where the person's going to be usually.
Yeah.
So we've got sensors, more than one, but we've got sensors that we can use I say they don't use wearables and cameras that can collect heart rate, breathing rate, check for sleep apnea symptoms, check your sleep quality and cycle and whether you're lying awake. And like we've got sensors that do that as various different ones, most of which when they're deployed, you can't even see. They either go under the mattress of the bed or as we've discovered the hard way, a lot of seniors do little or none of their sleeping in their beds. They do their sleeping
Yeah.
on
Mhm.
their recliner. Turns
Yeah.
out you need a
Get that a lot.
completely different technology to do that, right? The same device, beautiful, amazing, cost-effective device that works great on a bed, doesn't work on a recliner. You got to go find another company, completely different technology, similarly magical, but works when someone's sleeping on a recliner. And that's pretty much the story of, from a sensor perspective, our business is speaking to clients, what would be useful information, finding the sensors that can deliver that information cost effectively and reliably and passively, discovering the exceptions and going, except for in this situation, and then going finding the few other amazing devices that you need to complete the picture so that when we go see a client, we can go, great, what are we looking at here? Sleep, health, and activity. Great. Here's 3 sensors that will do that. You don't need to know who makes them. You don't need to know how they work. We just take care of all that, get it deployed, fire it up, and off we go. But where possible, as you point out, they are passive. And as I say, it's things as sophisticated as
Mm.
collecting health information, but through to really simple things like the door opened or
Yeah.
somebody went into the bathroom during the night. Some of the sensors are quite simple, but the data that they provide us with is really critical if you're concerned about somebody living with advanced dementia. You really want to know when the external door of their residence opens. Or
Yeah.
if somebody is prone to UTIs, you want to reliably be counting how many times they visit the bathroom at night. And both of those are really simple sensors combined with a few more sophisticated ones around their homes that together give you this complete picture that we can analyze in the background and use to indicate when something needs doing.
So as a sensor and data nerd myself, like tell me about which you're using. So you've talked about ones under the mattress, under the chair, like ones that can sense whether the door is opening, can,
Yeah,
track UTIs and
yeah.
continence. Like I've kind of looked on your website. It kind of seems like, there's sensors placed everywhere, but like what does that actually look like?
Well, what we typically do is we go through because we're going to be really careful, right? We don't want to
Yeah,
be causing a prospective or existing client to go, whoa, this is all getting a bit complicated because that's exactly the
exactly. Yeah.
opposite of what we're trying to do. And so, whilst we describe and demonstrate the different devices that we've already got and the devices that we're bringing onto the platform, I mean, some of the ones that are coming on at the moment, actually, one that we've just launched, again, not made by us and we take none of the credit, but they are magical things. One of them you may have seen is a device that the company that invented it, they call it the blood pressure monitor of falls risk, which might sound a bit weird, but anyway,
Yeah.
it's a device where you do a test and you do it regularly for the resident. and it's a grip test, and they squeeze a special device and it figures out however it figures it out in terms of relative strength and the whole bunch of other little measures that you get when you just say to someone, just squeeze that as long as and hard as you can. You do that regularly, and changes in that grip profile, apparently, well, clinically proven and by FDA and others,
As a
that
physical
profile.
therapist, I can validate.
Oh, well, there you go. Fantastic. And that will give you an indication of, for whatever reason, somebody's at increased risk of a fall just now. So you know what? For the next couple of days, let's take special care with this individual. Let's encourage them perhaps not to go on that long walk tomorrow on their own, but why don't we go with you? Or why don't we just leave it for that day and
Yeah.
we'll do some other exercises or whatever it might be. And so that's just come on to the platform.
Sure.
And then right at the other end of the scale, again, you may have seen this one as well, a device that goes in the toilet. And what it does is it analyzes the urine of the person using the toilet, does things like measure the specific gravity of the urine, which is a good
Wow.
indicator of dehydration, and does a few. In fact, they've got different cartridges that go into this unit depending on the particular things that you're interested in. So we had no idea that devices of this kind were going to be 5 years ago, when we were all buzzing along, deploying things and thinking this is
Mhm.
fantastic. Every couple of months, I mean, every day there's another device on the market, but every couple of months there's one that makes you go, wow, number one, that's amazing. And number two, how on earth does it do that? I'm glad I haven't had to spend the last 5 years figuring out
Yeah.
how to make it do that. And then we'll get the device and we'll try it out. We'll integrate it to the platform. We'll go to a client and say, hey, we got something that does this. Do you want to give it a go? And then they'll try it out. And sometimes they'll come back and say, it's fantastic, but it doesn't work for seniors. There'll be some reason why, right. Do you know what? What could be simpler than a door sensor, right? Has the door
Yeah.
opened? Really
It
basic
opened.
piece of
Yeah.
information, right?
Mhm.
If you put a door sensor into the home of a senior who's living with dementia or Alzheimer's and they can see it, there's a pretty good chance it's not going to be there at some point in the next couple of days. You just wouldn't have guessed that until you've done that and gone, wow, what? There was something up on the door there. I've got rid of it. It's like, right,
Yeah.
okay. So
Uh,
turns out
I'd do the
just something
same.
as simple as a door sensor, it's got to be invisible. So then you go
Yeah.
back on the mind and go, right, we need to find an invisible door sensor that once it's installed, you can't even see it because otherwise it's not going to work in memory care. So as I say, in each of the categories of sensor we've got a multitude of different devices that we use depending on circumstances from a whole bunch of different companies, some of which are specialist health technology companies, some of which are definitely not. They make general purpose products that are available in their thousands, their hundreds of thousands all over the world. They're proven, they're regulated in the environments they need to be, and we just bring them onto the platform.
That's what I love. I think your solution is just so modular, right? It gives options to meet any operator, community, older adult caregiver right where they're at, rather
That's
than
right.
telling them, hey, we're prescriptive. We've got our product. This is what you need. Take it or leave it.
You're absolutely right. And that actually, Daniel, that was the point I was going to make earlier on and didn't. But that is that beginning of the journey with a new client, we encourage them to just take a really simple solution, two or three sensors. Some just take one sensor, but just two or three sensors, get it deployed, get everybody comfortable with this idea that, wow, this little applications telling me to do stuff. And when I go and do it, things get better. I like this. I mean, as people get comfortable and familiar, especially in an environment, I mean, it's not uncommon in our client base for staff turnover in terms of frontline care staff over 50%. So most of the people that we've introduced to the system at the beginning of the year have moved on somewhere else by the end of the year, which is very challenging for our clients. I mean, for us, it's great. They go to another organization and say, hey, we had this
Mhm.
amazing system back where we were called Amba. But anyway, but things have got to be really, really easy to use and really easy to engage with if you're in an environment where you've got over 50% staff turnover. And so we recommend a really simple starting point. And many of our clients just leave it at that because it delivers great results. Just those three sensors will deliver great results. And then some of them go, great, I want to move on to medications. I want to move on to nutrition. I want to move on to GPS tracking and all that great stuff. And if they want to do that, we've got everything they need without them having to go, oh, here comes another application, here comes another data set, here comes another AI assistant. You can't have a myriad of those things in a real-time environment where you want your caregivers to be caring, not to be staring at applications.
Exactly. And that moves nicely into the my next question around, so you have all these solutions, right? But every time you add a new one, you add complexity or potential complexity to the
That's
solution.
right.
How do you manage the balance between, complexity and robustness of solution with that simplicity? Now, you already mentioned a few things, starting small, making sure that you have everything integrated under one umbrella. But what
Mhm.
other ways are you guys managing that complexity simplicity balance?
Yeah, that's a really great question because it's very, very different depending on whose needs you're serving in our client base. So if you're a frontline caregiver, it's got to be really simple. It doesn't matter how complex the back end is. If the front end's complex, it's just not going to work. And so what we've tried to do there is for frontline caregivers to just be providing them with the alerts and the insights that they need at the time they need them. So not, for example, requiring frontline care staff to go and read reports and so on, but to just say, look, when you get an alert, it'll say, can you go and attend to this resident for this reason? And when you've done that, can you close the alert down? And we allow our clients to decide, are you just going to let people close the alert down? Or do you want to have a selection of reason codes just to say something, just to go,
Yeah.
I'm closing it down, the resident was fine, or I'm closing it down, we had a serious situation, or even add a little bit of text. But even something like that, where you're just saying, here's an alert, I'm closing it down, what's the minimal involvement and hassle that we can place on the caregiver to just let them go and get on with what they're doing? We do need to know something. Our client needs to know something about what the conclusion of the alert was, but make it really, really simple. On the other hand, some aspects of the platform are more complex, and you've just got to deal with that by saying, right, some members of staff are going to need to be able to operate slightly more sophisticated parts of the platform. Obvious examples being, how long is it okay for Stu to be out of bed for in the middle of the night?
Yeah.
Stu is fit as a fiddle, lives in IL, he gets up and goes to the loo. But so we don't want an alert going off 20 seconds after he gets out of bed. But how long should we leave it? Should we leave it 15
Mm.
minutes? If he's out for 15 minutes, we'll give him a call or go see him. Whereas another resident at a different stage of their lives might be very vulnerable and you want an alert as soon as they get up. So just something as simple as that. All of those things are configurable, and you need to configure them. And we try and make that as simple as possible. We try and make that as intuitive as possible, but it does need someone to be able to operate that part of the platform. Similarly, our AI agent, which is breathtakingly, I mean, it blew me away when it came up
Mm.
and we started rolling out into production, is really, really great. But even the AI agent, you can ask it anything you like. You can just go, hey, how's everybody this morning? Is everybody up? Or is there anybody, you can see all that on the platform, but you can just
Mhm.
ask the AI and it uses our user interface to come back and answer the question. But even that, you want to make that even simpler. So, for example, a really common use we found of our AI was Daniel's daughter has just arrived to visit and she didn't tell us she was coming. And she's just got here and she wants to know how Daniel's been for the last few weeks. Can I have a really nice report that he's going to
Yeah.
understand? Da, 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 da. And so it'll produce you a beautiful report based on all the information it's got and write it all out. And da, da, da. Or even I've got to have a difficult conversation with the family of one of our clients because we need to change their care plan. Can you help me, build a report based on real data that it helps us explain why this individual needs a higher level of care than they're currently receiving? But all I'm trying to say is even that we can make simpler. So what we do with those commonly used requests is can them and just have them as you in the AI. Instead of someone typing out that whole question, you just go, oh, it's a residence relative visiting. Click, and it just writes out that whole thing in the
Very
in the way that So simplicity is totally critical at the front end, even when you've got AI helping you. But it does mean that somebody somewhere has got to be understanding of the slightly more sophisticated bits of the application. And that's just a fact of life. But we try and ensure at all costs that the front end of the application is extremely simple.
Yeah, and on that note, I mean, beyond just making, the technology and the application, the hardware and the software more simple, I also noticed that you guys put a lot of emphasis and energy on the people side of the business. So whether or not that's, making sure that you spend a lot of time with the person that you're implementing the technology with, making sure there is that advocate and that champion within any community that you're integrating in that knows the technology through and through. It seems that you'll have a lot of support for anybody that you implement with.
Yeah, yeah, and that's what we found that to be really important too. In fact, we're leaning into that with some new services where, faced with that 50% staff turnover, but just in any case, and by the way, it's not because we're super clever. The reason that we don't do certain things is because we try them and they don't work, right? Okay.
Yeah.
So, for example, what you can't do is say, hey, we're going to do Amba training on Monday morning at 9 o'clock. Can everybody be there? Because we're going to do the training. And everyone comes in and we go, here's Amba and this is how it works. And this is how you close an alert down and so on. You don't do it like that. It turns out, first of all, what you do is you deploy the sensors in the homes of the people you're going to care for, and you leave it for a couple of weeks. And nobody looks at it and nobody uses it. You just let it buzz along for a couple of weeks, make sure that everything's working okay. That's one of the advantages of leaving it a couple of weeks. But then when you go back on shift, because we go in alongside caregivers and say, right, the system's now working. Can you see? And you show people, like, look, it looks like this particular resident this morning overnight we've noticed symptoms of sleep apnea, and they go, wow, that's Mrs. Evans. I didn't know Mrs. Evans had sleep apnea. And you go, ding, we've just landed
Yeah.
a great piece of training, right? Because they're looking at information about people that they literally care for. It's what they're doing, right? So they're suddenly looking at information and receiving insights and alerts about people that they know,
Yeah.
rather
It's
than
not
it
making
being
up
some
hypotheticals.
nothing hypothetical about it at all. It's not some fictional training system. It's this is the real system and it's working right now. And you can respond. And we're here with you to show you how to. Should we go and see Mrs. Evans right now? Look, I'll show you here. We can close that alert down. Everything was fine. Bang. That's how you use it. And so it turns out the way to embed systems of this kind in the environments that we work with is number one, try and always work with real information that people recognize because they will absolutely, that's how great
Yeah.
caregivers are wired, right? They care about real people. And if you're showing them information about real people, suddenly it's not a system, it's an assistant. And so that's one thing that we do is try and always use real information and work on the terms of our clients. And the second thing that we're doing, which is completely counterintuitive for an apparently SaaS type business, is to actually to enhance support. So at the moment, a conventional request for support from somebody on the front line might be, oh, a resident has moved from IL to AL and a new resident has moved into their IL unit. I've
Mm.
forgotten how to do that. How do you do that
Yeah.
again? I've got to move that. How do you do that? And we, of course, would go, let me show you how to do it. Like share screen, show you how to do all that kind of good stuff. What we're now doing, and we're of having to obviously modify our contracts somewhat to allow us to do it in each of the jurisdictions that we're in, is rather than just saying, let me, I'll explain to you how to do it, to just say, well, why don't I do it? This is going to happen again in 4 weeks' time, and you may or may not be the person who's trying to make the change. And I don't know about
Yeah.
you, if I do something now and you ask me to do it again in 4 weeks' time, I'm probably still not going to remember then. So why don't we just say, look, I'll do it for you right now. It'll take me 2 seconds because I do it all. Well, not literally me,
Yeah.
obviously, but
Yeah. Yeah.
but actually and we're calling it Amber Assist, whereas
Mm.
it's not supporting, it's actually directly helping your frontline staff to do the things that need to be done. If we can do them, we'll offer to do them, and
And
that's
it's a real person behind the screen helping them
yeah,
out.
yeah, that's right. And part of the reason we can do that, which might sound incredibly selfish, is when we built the AI, and it's all open AI based and it's all proper BAA, privacy, zero data latency, all the great stuff. But once we got it working and it understood all the data that we collected, it also knows how the system works. So if you said to, hey, Amber, I'd forgotten how to move one resident from one place to another, Hey Amber doesn't just explain how to do it, but it gives you a link to exactly the page that you need to do
Mm.
and says, when you
Very
get
cool.
there, you press that button. And so we can say that to our clients and that maybe they'll do that. But also it means we can do it in a heartbeat. When they just go, I can't remember how to do this, you go bang, 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 bing. Okay, here it is. Let me show you what I'm doing. Are you comfortable? Da, 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 da. And it actually is very easy for us to take advantage of the AI tools that we've built to do this work really, really quickly. And I should just say, if you haven't seen it, it's worth a look.
Yeah.
Uh, there was a really interesting article. I think it was Sequoia, one of the big
Okay.
VCs,
Yeah.
and they've said the next trillion-dollar company is going to be a software company masquerading as a services company. So what they're
Mm.
saying is take advantage of your own productivity tools to offer amazing service to your clients. And
Yeah.
that's exactly what we're going to do. They're going to go, wow, how can you do this cost effectively? You just go, have you seen how incredibly simple it is to use our platform now? Because we've got an AI that
Yeah.
helps us around to find the right place to make the changes and so on. So, and that's what we're trying to do is just offer great service using the productivity tools that we built that our clients can use if they want to.
That's very interesting because it's like you deal with all these companies that they create this software and it feels like they don't use it at all because it doesn't work, right? So to know that you guys are the ones using it and saying like, "Do you know how I know this works so well? It's because I
Yeah,
use it all the time and you
that's
can
right.
see how efficient I am using this." So it's kind of like this reinforcement feedback between the software created and the people that created them acting as
That's
users.
absolutely true. And where we've seen that already in practice is with our remote patient monitoring program, where we've got teams of people supervised by physicians looking at Amber every day for each of your residents for a minute or two and going, yeah, everything looks great here. You know, alerts may or may not have fired, but a human being also looking at the data is reassuring and useful. And we've got loads of people doing that for thousands of individuals where these people are using Amber remotely just to look at the information that's being collected and then raise an alert if they see something a bit unusual or if they think it's worth checking has someone changed their medication arrangements because their vitals have changed quite a bit just recently, things like that. And so this idea of remote support, people on the ground are uniquely positioned to make a difference directly to the individuals that are being cared for. The rest of us who are remote should be doing everything we can to make their day as efficient and as well directed as we possibly can. And there's a lot you can do without being present if you've got a system like Amber that collects you the information and gives you the tools to do the things you need to do. You can really make a difference and offer a lot of value without actually being on site.
Yeah, I want to get into that a little bit more around the value-based care angle with Amba. How does your monitoring solution and the data that you capture allow operators to kind of capture some of that edge reimbursement around value-based care, remote therapeutic monitoring, et
Yeah.
cetera?
Well, it turns out that Medicare and CMS can see and have
Mm.
seen, and I guess approved the upside of collecting remotely viewable information about the health and well-being of people and taking a regular look at that information and making interventions where appropriate. And so there are CMS codes specifically for covering the cost of the technology that's used to collect health and well-being information and also to cover the cost of people monitoring the information that's been collected. And so in the United States, we have a large number of people who are benefiting from that service. We don't offer it, it's offered by our physician
Yeah.
partners, and it can be done by our clients directly if they have physicians that they in their organization and they already bill codes through Medicare. There are specific codes. Our system is compatible with, generating the reports that are required to make those claims accurately and auditably. So yeah, it covers the monthly cost of equipment and data transmission, the cost of the time spent by remotely managed individuals who are looking at the data and so on. And it's really effective. We've got some great case studies of improvements in health outcomes for residents who are benefiting from that monitoring.
So as a potential customer of yours, not only are they getting maybe some reimbursement to help them cover the cost of implementing AMBA, but you're also giving them a new revenue stream or a potentially new revenue stream if they choose to act on it.
Yeah, yeah, and that right now that's between our client and the physician groups that we
Yeah.
work with. But yeah, but those physician groups will assess each individual resident, and confirm whether or not they, qualify in terms of having a chronic condition and the data that we're collecting being relevant to the management of that condition. They will then gain the consent of the resident. I think just verbal consent is required to the doctor, and then the doctor will go and brief their team to look at the data, and then that organization will typically reimburse our client for some of the cost of the system because they're being reimbursed by Medicare for the technology. So that bit of it, they'll pass back to the client. Yeah.
Very cool. Where do you see this realm of remote therapeutic monitoring, passive sensors, value-based care, AI, like the intersection of all these things? Where do you see it going over the next 5 to 10 years?
Well, the signals certainly in the US are very, very clear. CMS is making it, I mean, they're spending $1 trillion on providing care to seniors in the US. And of course, it's in everybody's interest that that $1 trillion is spent
Yeah.
as effectively as possible. And so that remote patient monitoring thing I was just describing is a really rudimentary but effective way to begin that journey. There are other programs, Access and Tempo and value-based care and so on, that are moving more directly towards how do we make sure that the right technologies are being deployed to keep people safe and out of the hospital. But in terms of value-based care, I don't want to call it the extreme end, but its ultimate goal, right, is to
Yeah.
say, if you as an organization want to take responsibility for the health and well-being of these individuals, and you can keep them out of the hospital and they suffer less falls and they suffer less serious infections, there should be some really big rewards available, and there are, for
Yeah.
organizations that are prepared to do that. And that's where we're really excited because at the moment, for example, take Simpson in Pennsylvania, one of our early clients in the US, where they deployed our system in memory care just to try it out, and falls more than halved, and hospitalizations went down 35% in the first quarter, right?
Yeah.
Now, they are delighted about that. We are delighted about that. We got some fantastic video material. They get up on stage with us and go, this stuff really works.
Mhm.
But they got no economic reward for doing that. Now, of course, it's hugely beneficial to them because, as you say, those residents will live for longer in their communities. It's a great marketing tool and that kind of stuff. But just think of what the impact of those numbers are on the health system in Pennsylvania.
Yeah.
That's where the real action is. They just go, well, the organizations that have taken the initiative to deploy not just the technology, but the changes in processes, the changes in training for their staff, the people that have done that and are materially reducing hospital admissions and serious infections, that's where value-based care really, really changes the game because it turns doing that into a very, very economically rational thing to do, as opposed to a very good thing to do, a great thing for your residents. You can just about make the numbers work. It turns it into a really major strategic thing that we're
Yeah.
really looking forward to happen. It's happening. It's complex, but it's happening. And we're very excited to be in a place where we can directly contribute to the organizations who want to do that.
Because unfortunately, right now we kind of have this perverse incentive system with services based payment where it's like the more services you provide, the more you get paid. And so
Yeah.
it almost like punishes you for efficiency and it relies on the altruism of the healthcare provider or the operator to say, well, we really do want our patients to get better. So we're going to provide best care and
Yeah.
almost limit the amount that we can charge based off services because we're doing it more efficiently. So this flip around augmented by the data like that companies like Amba can provide, I agree with you. It's the next steps in healthcare and really tackling some of the big problems that we have as a healthcare system in the US and, I'm sure in the UK and beyond.
Absolutely. And once again, as we were saying before, tackling those challenges in the ways that we are doing that and our clients are doing that is great for everybody. It's not
Yeah.
it
Yeah.
reduces the overall cost of providing healthcare to a senior, but not because we're reducing the quality of the care. It's because we're
Yeah.
reducing the frequency with which they need the more expensive interventions that are never pleasant or beneficial, overall. And that's great for everybody. So, I mean, it's
I love a
fantastic.
good win-win solution. Always love it when that works out. But I know
Indeed.
we're pushing right up against the edge of our time, Stu. I really appreciate you being out.
Oh, it's such a pleasure, Danny. Every opportunity we've got to share what's happening, not just in our company, but in our clients and in other organizations like ours, it's always a pleasure and a privilege. So thank you very much.
Now, I know you guys have been a long-term friend of AgeTech Connect. I know you were present at the Home Care and Home Health Innovation Workshop at USC, right?
Yeah, my colleagues were. So
Yeah.
yeah, we've had some great feedback from that event, and we're looking forward to continuing our association. It's amazing. The things that you're doing are really important, and they're going to make a difference to so many people in the future as we inform everybody of the possibilities of connecting, basically putting technology in the service of care providers. That's what this is all about. There's so much more for us to do, but organizations like yours are really helping us to do that.
I really appreciate the kind words, Stu. Where else can the people out there, if they're interested in getting in contact with you, maybe they want to purchase your solution, maybe they want to work with you or offer, like, where can they get in contact with you?
So the simplest and most reliable place is go to amba.co. That's not amba.com, by the way. So amba.co, and you'll see there's plenty of buttons there saying ask for a demo, whatever. Right? They all come to the same
Yeah.
place. All of it comes through my inbox as well as our sales and marketing team. So that's the simplest way. I can be contacted directly, Stu at amber.co. You're very, very welcome to drop me a note there. If you're at any of the big age tech and senior living events in North America,
You should
we're
be.
yeah, we're at
No.
many, many of those. The Senior Living Innovation Forum, Senior Living 100, your events and so on. We get around to lots of those. And actually, the gigantic majority of our clients come from events like that simply because of most of them. We've got one of our clients up on stage, way more credible than I'm ever going to be, right? A real organization up
Yeah.
on the stage saying, I heard about this company 18 months ago. We've just deployed this system and these are the results that we're getting. And that's just, there's nothing better than that. So make contact via the website or drop me an email or come along to one of those events and be absolutely thrilled to talk to you.
Well, very cool. Thanks again, Stu, for being out, and I
You're
look
very
forward
welcome.
to talking to you and working with you more in the future.
Fantastic. Thanks very much.